During the COVID-19 pandemic, our goal is to reduce the burden on the healthcare system by keeping patients safe, functional, and at home. The emphasis is on preventing hospitalizations and reducing both amputation and death in people with diabetes and elderly patients with comorbid conditions. Patients with severe infections, sepsis or gas gangrene, and acute limb-threatening ischemia, IV antibiotic failed osteomyelitis patients, admission to hospital remains the recommendation. However, everyone else with chronic non-healing wounds or chronic limb-threatening ischemia with active and inactive Charcot foot who are not yet in stable footwear, other foot ulcers and venous leg ulcers must be treated with maintenance wound care at their location. Since the outbreak of the COVID-19 pandemic, wound care surgeons have been modulating the approach on how to support a growing number of wound care patients being treated at home by the multimodality. One, the use of autologous skin cell suspension in addition to compression has been shown to accelerate healing in large venous leg ulcers. According to the results of a multicenter randomized trial conducted in the United Kingdom by Hayes et al. Second, topical wound oxygen therapy is limb-saving therapy that can now be provided in home setting. Lastly, I want to talk to you about wound dressing. Studies demonstrate that keeping wounds covered with a dressing for longer may be beneficial to promote optimal wound healing. Dressings that help to create an appropriate moist environment while absorbing excess exudate for more than 3 days can promote undisturbed and faster healing. Wound care specialists consider patient compliance as a big issue for frequent dressing changes, with nearly 50% reporting that their patient removes the dressing before it needs changing, and some 35% report that their patient complains the dressings are not comfortable. There is pressure to use lower quality, cheaper dressings if you are dependent on insurances to cover those. But this ignores the bigger picture. For example, home health or hospice nurse can cost more per visit, and so the insurances ends up paying more in nursing time. When there is an investment in superior products, a wound can heal in weeks rather than months. Aside from saving money, this also has a positive impact on a patient's quality of life. Thank you.